Imagine starting your morning routine only to glance into the toilet and see something alarming. Your heart skips a bit. Is it nothing? Or is it body trying to tell you something important? It turns out your bowel movements can reveal vital clues about your health. Welcome back to our channel. In today's video, we are going to empower you with a knowledge about what different poop appearances. We will break down unusual stools colors like red, black or clay, white, and what they could indicate from bleeding to diet causes. We will cite the latest gastroenterology research, gut microbiome findings, and nutrition science to back off everything we discuss. And here is a little surprise. Stick around till the end for a special giveaway. We have created a free printable Know Your Poop summary, a one-page cheat sheet of all the key things from this video. It's our gift to you so you can have a handy reference, maybe taped inside your bathroom cabinet. We won't tell. Now, let's dive in figuratively and decode what your poop might be telling you. One of the first things you notice is color. Normal stool comes in a range of brown shades. In fact, doctors say all shades of brown and even green are usually considered normal. Stool color mainly depends on what you eat and how bile, a digestive fluid, colors your waste. Only rarely does colors alone signal a serious problem. That's reassuring. However, rarely doesn't mean never. Certain color changes can be red flags, especially if they persist or come with other symptoms. Let's break down the cues. Bright red stool or blood. Seeing red in the toilet bowl can be startling. Sometimes it's not as bad as it looks. For example, eating red-colored foods, beets, tomatoes, red food dye, can turn your poop reddish. Even something like beetroot can make the stool look bloody when it's actually just beet pigment. However, red stool can also mean there is fresh blood in your poop, typically from the lower digestive tract. Bright red blood on the stool or toilet paper often suggests bleeding in the colon or rectum. Common causes include hemorrhoids or anal fissures. It could also be from a more serious sources like a colon polyp or colorectal cancer in some cases. Gastroenterologists warn anytime you see a blood in your stool, especially if it's reoccurring or accompanied by any other changes, you should get it checked. Even if hemorrhoids are likely culprit, it's worth ruling out anything more serious. So, if you spot red and it's clearly not because you had a big bowl of beet salad, call your doctor. Black tarry stool. A jet black tar-like stool can be another alarming sight. The medical term for black stool due to blood is melena. Black sticky false smelling pus often means all blood from higher up in the GI tract, like bleeding ulcer in the stomach or small intestine. As the blood travels down, it turns black and tarry, hence that distinctive look. But here is a nuance. Black stool isn't always blood. Certain foods and medication can harmlessly turn your poop dark. For example, taking iron supplements or bismuth medications like Pepto-Bismol can make stool blackish. Even eating a ton of blueberries or black licorice might do it. So, how do you tell the difference? If your stool is truly tarry in texture and has a strong, unusual odor, and you haven't eaten or taken something that explains it, that's a warning sign. 3. Black plus sticky plus smelly usually points to old blood. This is a scenario where you should see your doctor promptly because internal bleeding is nothing to mess around with. And on the flip side, if you did take iron pills or bottle down a Pepto for your upset stomach, that could explain a one-off black stool. So, when in doubt or if it persists, get medical advice. Pale clay, colored or white stool. Pale gray, clay-like or white poop is not normal and can indicate something serious. Stool gets its normal brown color from bile, which is a digestive fluid produced by your liver and stored in your gallbladder. If poop is very pale or clay colored, it often means a lack of bile reaching it. One common cause is a bile duct blockage, for instance, from gallstone or inflammation that prevents bile from coloring your stool. Liver diseases can also cause pale stool by impairing bile production. In plain terms, white or clay stool equal to possible liver, gallbladder, or pancreas issue. It's an immediate red flag. Now, could there be a benign reason? Possibly a few. Certain antacids or antidiarrheal meds like large doses of bismuth or recently having a barium enema X-ray can temporarily turn stool whitish. Drinking excessive dairy has been noted to pale out stool in rare cases, but these are relatively uncommon situations. If you haven't done those and you see pale gray poop, especially if it comes with a dark tea-colored urine or yellowing of your eyes or skin, like jaundice, that could signal a bile flow blockage or liver problem. That combination is considered an emergency. You should seek medical care right away. Yellow greasy stool. Yellow is greasy looking poop that floats or sticks to the ball and smells really foul, can also be a sign to pay attention to. First, let's note some harmless causes. Obviously, eating a lot of carrots, sweet potatoes, or foods high in beta carotene can give stool an yellow orange tint. And a super fatty meal, think fried foods or a big cheesy feast, might result in a pale, oily stool once or twice. However, yellow greasy stool, steatorrhea, often means fat isn't being absorbed properly in your gut. This can happen in conditions like celiac disease, gluten intolerance that damages the intestine, or pancreatic insufficiency when your pancreas isn't producing enough enzymes to digest fat. In these cases, excess fat is excreted, coloring the stool yellow and making it shiny or oily to the eye. Sometimes you might even see oil droplets in the toilet. It also tends to float due to the high fat content. If this kind of stool appears occasionally after a junk food binge, but that goes away, it's likely diet related. But if you consistently have yellow stools, mention it to your doctor. It could point to something like celiac, chronic pancreatitis, or other malabsorption issues that need attention. Green stool, usually benign. Green poop can look weird, but on its own is usually not a cause for alarm. Diet is a common culprit here. So eating a lot of green leafy vegetables like spinach or kale, or foods with green food coloring can tint your stool green. Iron supplements may sometimes give stool a greenish shade too. Another reason for green stool is when things move through your intestines quickly. Example, during a bout of diarrhea, so the bile doesn't have time to turn from green to brown. Most of the time, green stool is considered within normal variation. So if you see green and you feel fine otherwise, it's likely due to what you ate or minor upset that will pass. That said, if you have persistent green diarrhea along with stomach cramps, it could signal an intestinal infection or irritable bowel syndrome where food is rushing through. In those cases, a check in with a doctor is wise. But generally, think of green poop as your digestive system's version of green means go. Usually nothing major to worry about. Now that we have covered the rainbow of poop, remember, context is everything. One oddly colored stool after a crazy food weekend isn't a reason to sprint to the ER. But if an unusual color keeps showing up or comes with other symptoms like pain, bleeding, or jaundice, that's when to take it seriously. So, when in doubt, a quick call to your healthcare provider can help figure out if it's eat more veggies or get this checked. So, before we move on, here is a quick fact. Gut microbiome research shows that even the consistency of your stool, not just color, is linked to your health. A study in Gut Journal found that stool from on the Bristol stool chart correlates strongly with the makeup and richness of your gut bacteria. In other words, your poop's appearance is literally reflecting what's going on in your gut. Now, as promised, here is our surprise giveaway. We have prepared a free printable "If your poo looks like this" summary for you. This handy one-pager lists all the key stool warning signs we discussed, with a brief reminders of what's serious versus benign. So perfect to tape it inside a cupboard or even near your bathroom for quick reference. To grab it, just click the link in the description or pinned comment. It's our way of saying thank you for watching and to help you remember these tips when you need them. If you found this video helpful, please give a thumbs up and share it with someone or anyone who might benefit. Health is a gift best shared, and don't forget to subscribe to our channel for more science-backed, approachable health guides, especially gut health and gastrointestinal health guides.